What caused the disease?
Well, hypertension is caused by many factors. Usually, ambient factors like obesity or sedentarism is the major cause of hypertension. So basically, there's no true cause of a true only familial cause. It's a multifactorial thing that affects the new lifestyles that promote obesity, sedentarism, bad diet are the primary cause of hypertension.
How serious is it and how does it affect the patient's lifestyle?
Well, the disease itself is not a very serious thing if you have it under control. I mean, you can have a patient with hypertension that is controlled with medication and he should live a normal life. Hypertension by itself, without medical treatment, it's a life-threatening disease. It will shorten your lifespan and will cause, well, many types of diseases, right? You can lose your eyesight, renal disease, heart failure, it depends.
What is the short and long-term prognosis for this disease?
If you treat the disease as itself and you change your lifestyle, you bring down the deleterious factors in itself. If you leave hypertension untreated, well, it is called the silent assassin. It will kill you if you don't treat it.
What was the chief complaint that the patient had for consulting?
Well, basically, when someone starts with hypertension, the first symptoms are usually very specific. They come to the ER, to the emergency room, complaining about headaches, flash of lights in the eyesight. But it's very specific. But most of the time, headache, shortness of breath is the main symptom.
What other symptoms does the patient present?
Well, if you leave hypertension without treatment, then other organs will fail. So some people that leave the disease on its own, take its own course, will have the symptoms of renal failure. Some people will start with symptoms of heart failure. And the worst case scenario is when people are basically with no symptoms at all and they do like a serial hemorrhage.
How can the patient be tested for the disease and what does this test reveal?
You need to take your blood pressure every now and then, and if you're in the limits, well, you're okay. Now, if you're having some measurements are on the high side, well, you need to repeat those measurements a couple of weeks apart so you can actually define someone as having hypertension.
What are the treatment options?
Basically, it's lifestyle thing. I mean, if the lifestyle promoted you to get hypertension, you should change your lifestyle. Exercise, eating less salts, in the most cases control initial parts of the sickness, but in the end it's medications that will control hypertension.
What treatment is the patient receiving and how effective it is?
Well, most of our patients that are treated with hypertension take oral medicines. And basically it's just 1 or 2 takes a day, so it doesn't interfere in the lifestyles. Those patients that have a more advanced disease, well, they have to have special diets for their renal disease, for their eyesight. So it depends on the spectrum of the disease, what they can or cannot do.
What would happen if the patient doesn't get treated?
Well, most of the people who don't treat their hypertension usually end up in two categories. Those who make a myocardial infarction, but most of them end up with renal disease. I mean, they end up in the hemodialysis unit.
What new technologies exist for preventing, diagnosis, or treating this disease?
We don't need much more technologies. I mean, this is a very simple disease to diagnose. The thing is that the more modern lifestyles are impacting a lot, and that we have a lot of hypertension now. But basically, we don't need more technologies. I mean, it's about a lifestyle changes, basically. It's not a disease that needs new technologies like cancer or anything like that. It's very simple.
Okay, well, it's all, and thank you very much.